All right, there we go. All right, I'll share my screen. Okay. As I mentioned on Tuesday, this is Introduction to Psychology. Um, And again, just as a quick reminder, this is going to be a survey course. So we're going to touch on different aspects of what psychologists study and try at the end, hopefully you have a better understanding of how we try to explain human behavior and mental processes. So that's kind of our goal, is to kind of do a building process of doing that. The way we're going to start is we're just going to talk about how psychology is defined, and then we're going to get into a discussion about the goals that we have whenever we're investigating some psychological phenomenon. And then we will get into some of the myths and misunderstandings that are very common about the field. Um, and then we'll build on that by talking about different ways of understanding human behavior through something called pseudo-psychology. And then we'll start to get into some of the philosophies and stuff that psychology has inherited. So this is that kind of that beginning part of that building process of understanding. So let's get into, though, the definition. No, what, oh, okay, definition. Psychology comes to it's two parts, psyche and ology, and or logos. And the logos part just means the knowledge or the study of. So sociology is a study of social world. Anthropology is a study of people and ways of and way people. I got to get that right. Anyways, so that's the ology part, but the psyche part, the one of the more common definitions of psyche comes from the Greek word of mind. Okay, mind being that thing that gives us a sense of self, gives us our ability to be conscious about being in this room and experiencing the in or wherever you're at in Zoom land, and who you are as a person in time, place, and space, and feeling like you have a sense of, I guess, being. Okay. But if we look at the really root meaning of mind, the literal translation of psyche is for the word breath. Okay. Because for the Greeks, what they believed is that when you take your first breath, you breathe in your soul and mind, or soul mind, whichever term you want to use. And when you take your last breath, you breathe out your soul or mind. Okay. So, and this is going to be one of the first philosophical debates that we'll get into, is what's called the mind-body problem. Is the mind something separate from our mechanical body? Okay. And so we'll get into that debate, but also the substance of the mind is something unique to the human experience, given this definition. Okay. Now, mind has been the traditional definition, but I want to give what we call a construct definition, and it's termed the modern, or we could call this contemporary definition. When we talk about a construct definition, it means that it's something that we can commonly understand of what we're studying. We have a way to measure and to understand what it is that we are actually investigating. Okay. So, kind of the construct definition that we'll use in this class is psychology is the scientific study of behavior and mental processes. Okay. Now let's break three of these terms down. What do we mean by scientific? Scientific is that we're using some type of objective measurement, whether it be a quantitative method, or where we're measuring statistically or doing statistical predictions, or a qualitative methodology where we're doing something like a case study or we're doing interviews within a community to come up with understandings of what's going on in that community. Okay, it's a systematic way of collecting that quote unquote data or those experiences. And the reason why we use the scientific method is so that other psychologists can take our findings and try to replicate them. Okay. And throughout this course, I will mention things about recent research has indicated, but I'm always going to follow this up with, but I'm waiting for further replication of that research to see if it holds. Okay. And so that's kind of how we try to work in this field. Okay. When we say the study of behavior, we're meaning those things that the person who is studying it can observe, or those overt things. So we can observe things like how a person reacts to some stimulus in the environment behaviorally. In this example, you can observe someone crying or smiling. We can observe things like reaction time and those types of things that I can observe directly. Okay. When we're talking about mental processes, these are things that are covert, meaning that I, as the person investigating it, has to go through someone to understand. So, for example, if I want to study your memories, I can't directly observe your memories. I have to ask you, what do you remember when on this date and this time? Okay. I can't directly observe your planning process and how you come to a conclusion of a problem. I have to ask you how you came to that conclusion. So things like memories, certain emotional states, certain ways of thinking about the world are all mental processes that I have to go through you to understand. Okay. Now, as psychology has evolved, we evolved from philosophy to psychology when the field adopted the scientific method to investigate human processes. And we now evolving into some people suggest that psychology should be called the study of the brain because more and more we're investigating neural processes and brain processes that tend to be associated with different psychological or behavioral states. Okay. And we're finding the brain probably is our kind of CPU as far as understanding the world. However, unfortunately, the issue with brain studies is brains imaging a brain doesn't actually predict actual behavior. Okay. And so when it comes to will certain brain activities always give a way to certain processes, the answer is no. And so until our technologies and our studies get more and more refined, we're kind of a little bit of ways of saying that psychology is the study of the brain. Okay. So, but we will bring up the three areas that we will talk about whenever we're talking about anything in this class, from memory processes to mental health processes. We'll always talk about the biological component, which is the nervous system usually. We'll talk about the psychological processes, which are those mental processes that we talk about, and we'll talk about the social processes, which tend to be those behavioral processes that we look at. So we'll, in each aspect of the topics we have in this class, we'll look at all three of those areas to try and understand human behavior and mental processes. Okay. So now, if this is the definition, the question is, what are the goals then? What are we trying to achieve? So, yeah, we want behavior, we want to know why people do what they do, those kinds of things. But what are some goals that we have whenever we start an investigative process? Okay. And I'm going to use a kind of a mental health example because it's a common experience. The majority of us in this classroom will experience this at some point in our life. Some of us may have the chronic condition of it, but we're going to use it as an example. So let's say you're out there investigating the world and you find this population of individuals who, during certain periods of their life or ongoing, they have disturbed sleep patterns, they have disturbed eating patterns, they have low motivation. They always seem to have uh, be in a low mood state. They have a hard time feeling things of like joy. They feel kind of worthless and kind of hopeless in their world. Um, and we notice that this is not common for everyone, but it can be experienced. So this is what we call the description. Okay, and so we're going to then try and classify this behavior, and let's say we label this behavior depression. Okay, maybe the reason we use the word depression is because we notice that the person's mood is severely depressed and their motivational state is severely depressed, and that is then inhibiting them from engaging in the world. Okay. So we come up with this description that we're just going to call this depression. Okay. Well, now I want to understand something. There's some people who seem to have depression for a very short period of time. There's people who seem to have depression uh, chronically across situations. And so I want to understand and be able to understand what causes this behavior in some people for long term and for some people short term and for some people who I feel are very fortunate human beings who never experience it at all. Okay. So I want to know what the causes of these behaviors are. So I go and I use my biopsychosocial model. And maybe in this case, I notice that a majority of these individuals, when they take something called an SSRI, which is a serotonin reuptake inhibitor, basically what it does is it increases the amount of serotonin in the brain. That when some individuals or a good portion of these individuals take that medication, it tends to relieve them of that emotional mood and motivational state. They have a relief from those symptomologies. Okay. And so on a biological end, I might say, well, depression could be caused by low levels of serotonin. Okay. I notice that maybe people who have chronic depression have a family history of depression. Okay. I notice that commonly people tend to develop depression when they go through a grief cycle, such as the loss of someone after giving birth to a baby. We call this post depression, postpartum depression. Sorry, couldn't get that word out. Um, I noticed that some people experience it when they experience trauma. So I'm starting to develop this causal model. Okay. I noticed that there's a biological end and then the cycle. So that's the social end, trauma, lived experiences, loss and grief. And then on the psychological level, I noticed that people who tend to have these symptoms tend to do something called rumination, meaning they feel so worthless inside that they go through their day looking for evidence that reinforces that worthlessness and and sometimes totally ignores any information that is counter to that. And then they ruminate about it, meaning they constantly process, I'm worthless because of this. I'm worthless because of this. I'm worth. And so there's this psychological commonality that when people get into that rumination, that seems to cause or associated with these different symptoms. Okay. So then I want to go from cause. If the cause is neurotransmitters, some genetics, rumination, and then in some grief and loss and whatnot, I want to predict or forecast when those will occur. So we know that depression is commonly associated with things like trauma and grief and loss. We also know that it's associated with chronic or what we call um, generalized depression, tends to have a large biological component. And so we can understand where these are coming from. So when you go to a therapist, they'll ask about your family history, recent traumatic experiences, losses, all of those things in order to come to this kind of quote unquote diagnosis of this thing we're calling depression. Okay. And then the last thing is that we want to control that behavior. In this case, we want to do something that relieves the person of their symptoms. So this can include antidepressants on the biological end, cognitive therapy, trying to help the person with the ruminations that they're going through, and then behavioral therapy, how they are interacting with their world in order to see if that then relieves or makes this depression that we've observed go away or is less or the person becomes better or more capable of coping with their world. Okay. So I'm using a clinical example because it's something that I think many of us can commonly relate to. But we do this with everything that we study in psychology. So if we're studying a memory process, if we're studying even on positive psychology, what makes some people, what is happiness, right? That's the description and all those kinds of things. I will tell you, as far as these goals are concerned, the majority of topics in psychology right now are in the description and understanding phase. We haven't gotten really accurate on things like prediction and control. We're still continually working and refining our understanding of those two areas. And so a lot of the topics we'll focus on is describing it. What is it? And what are the potential areas that bring that state about? Um, and then we'll look at maybe some of these other areas, but those are still areas that, as a young science, psychology still struggles with. Okay, so just put this in the chat. You don't have to unmute yourself or anything else. I just want to check in. Is everybody okay with the definition and the goals of psychology as they've been described? Just put yes or no in the chat for me. Okay, awesome. Okay, it looks like we're good. All right, thank you, everyone. All right. Okay, so let's move on to some of the common myths and misconceptions about psychology. I call these kind of the big three because they tend to be the most prevalent. Um, and the first one is that psychology is all about mental health, that all we study are the mentally ill, the kind of the awful aspects of life, and those kinds of things. And uh, and first of all, I have to state that this is an understandable myth. Okay. If we look, for example, at the American Psychological Association, greater than 52% of their members are clinical and counseling psychologists. If you go on the internet, a lot of the term psychology is often associated with articles you read on mental health and mental illness and all of those kinds of things. So this is an understandable myth. But if you look at our class schedule, you'll note that we'll only spend about 2 weeks talking about mental health and mental illness. Okay. Because the field is much broader. We have developmental psychologists that study how we change over the lifespan. We have cognitive psychologists that are just interested in our brain processes. We have industrial organizational psychologists that are interested in increasing the efficiencies within the workplace. And so we have a lot of different areas that we're interested in because we're interested in the complete human experience. Okay. So while it's an understandable myth, it is a kind of a myth that's all that we focus on. Okay. Myth number two is psychology is not a science. And again, this is an understandable myth. I think if I were to ask you, are you interested in why you behave the way you behave? You would say yes. If ever wondered why someone behaved the way they do, I'm thinking you would say yes, because we're all curious, not just psychologists, about why people do what they do. Okay. And so we all have these personal psychologies, our interpretation, but we also have something called popular psychology, which is people who go on and write articles and whatnot on topics that psychology also studies. Okay. And so this myth is also another understandable myth, but the academic study of psychology is science-based. Um, Everything we talk about in this class will be based on theory and research support, and we'll even do some theories that doesn't have much support, but there's inklings of it throughout. Okay. And so for us, everything we talk about in this class will be science-based. Okay. The other myth, which is one of my favorite, is psychologists can read minds. Okay. That somehow we have training and special talents and being able to read your mind. And if you're a psychology student, a counseling student, a social work student, drug and alcohol rehab student, you probably went to your friends and said, I decided to study social work, or I decided to study psychology. And a lot of times the first thing out of their mouth is, well, don't analyze me, or are you analyzing me? I want to make something clear. Well, psychologists study this stuff and we enjoy doing it. Psychologists, if we take the best clinical psychologists in the field, the people that are supposed to be experts in understanding our own behaviors and mental processes, do no better than chance, do no better than the person with no training in psychology at predicting or understanding someone's mind. We have to use tools, we have to use measurement, we have to use all of those things, but we're no better at predicting or understanding your behavior than the average person is. I always like to think of this in one of the areas that I began studying when I first did psychology because of the field I started in the field of domestic violence and relationship violence, is I got very interested in intimate relationships and the study of it. And we'll talk a lot about this throughout this course. But you would think after studying intimate relationships for 10 years that my relationship with my intimate partners would be amazing, but they're not. I make the same mistakes everyone else does because I'm a human being. Okay. So the reason why I bring this up is if, for example, you go to a counselor or a therapist and they spend 10, 15 minutes with you and they're already ready to diagnose you because they say that they can understand you just from your immediate interactions with them, leave and request a refund. Okay. It usually should take 3 to 6 sessions for a counselor to do all the interviews and assessments and all those things to really understand their patient and how to help them. So just something to say. I will say for those students who are in the helping field, social work, counseling, and if someone asks you, "Are you reading my mind or am I analyzing?" If they're kind of annoying, go ahead and tell them yes, because then you don't have to interact with them much more after that. So that's one advantage of this myth. You can actually use it to your advantage. I'm just kidding on that. Don't say that. Okay. So now, so those are the myths. Now, there are times that psychology has found initial findings and it has bled its way into popular culture. And it has created industries even of knowledge. Okay. And so there are times where, as a science, we have to kind of redact our mistakes in our research. And these are just some examples. This is not an all-inclusive list, but this is a kind of a good kind of gathering of different mistakes that have been made that have been are more now mythology than they are evidence-based. Okay, so I'll just go through these really quick. So the first one is the myth that opposites attract. Okay, originally within the study of relationships and stuff like that, it was hypothesized that two peoples of the opposite make a better relationship because one brings qualities that the other one doesn't, and it can create a more fulfilling relationship. Okay. However, what we actually have found after following intimate partners over time and doing what are called longitudinal studies is that individuals who are in long-term, satisfying, caring relationship is it's actually more like birds of the same feather flock together. That we're actually, if in certain areas you're looking for a good long-term relationship, you should look for someone who is similar to you, not different from you. Okay. Now, I always have to put this caveat. Human behavior is very, very diverse. And there is a subpopulation of people where opposites do tend to be the better mate selection. And we'll get to more details in that when we get later in the course, when we get to social psychology. But overall, people who are similar tend to have more long-term relationships and happier relationships. And the reason being, we think on the psychological level, is when you have someone who is similar to you and they have an emotional state, maybe they get angry or they get sad, you don't have to guess on how you have to react to them because you're like them and you know what they need. So you spend more time building a relationship than trying to learn and understand how to react to that other person. When you're in a relationship of the opposite, you tend to have to try and do trial and error over and over to try and determine how do I react when they're angry or sad or happy. And so you spend a lot more resources in just trying to develop a reaction to them than you do building that intimate relationship with them. So that's the current theory. The next one is lie detectors and lie detector tests. As you know, they're not admissible in court for very good reasons. And we actually have found that they are actually not very accurate at all. In fact, they have a chance rate. The accuracy of a lie detector is about 52%. Okay, meaning that it's no different than flipping a coin or flipping a penny, which I kind of feel bad for those people who went on that one show where they do lie detectors. It may not have been his dad, his child, and it may not have been he may not have cheated at all. Because again, we have found after replication and replication of lie detectors test, it doesn't predict lying. It depicts it at a chance rate. about flipping a coin. Okay. Next myth, which comes from popular media especially, is that people only use 10% of their brain. Part of this myth is because when we get to the developmental section, we will learn that human beings are only born with about 10% of our brain capacity. Um, and that's a physical thing. But this is a false. Believe it or not, you use all of your gray matter. All of your brain is active most of the time. And in fact, your brain is actually more active when you're asleep than when you're awake. That's kind of scary. But anyways, so that's a myth too, and that came out of again brain imaging studies, okay, and refinement of technologies that we have access to the brain and brain processes, okay. The fourth myth, people often repress traumatic childhood memories, okay. And what this is referring to is people actively repress traumatic childhood memory, that the child is making the choice to not remember that until later in life. Okay. And this is simply not true. You cannot purposely forget something. And the very simple example of this is, and this is a very, very simple example, is if I asked you to imagine a pink elephant. It can be a stuffed, fluffy pink elephant. It can be Dumbo. It can be a live pink elephant. Picture a pink elephant in your head. And when you forget that pink elephant, let me know. And so maybe I'd have you raise your hands and stuff and say, Dr. Peterson, I forgot. And I'd ask you, what did you forget? And you'd probably go, oh, that pink elephant. Well, guess what? You just remembered the pink elephant again. Okay, that's a very simple example of how repression and forgetting isn't really possible purposefully. But what is this thing about some individuals who get older in life and out of their childhood and into their adult life that they start to have triggered memories of past childhood trauma? Okay. Well, there is a mechanism in the very unconscious areas of your brain. And when we get to the biology section, you'll see that within the limbic system, we have an amygdala, which is kind of this little bulb looking thing. And then it kind of is extended into this other area. Okay. And I'm just going to cross section it here. The amygdala sits right here. And it is the primary area of the brain that responds to emotions. Specifically, it responds most strongly to the emotion of fear. What's connected to the amygdala just behind it is what's known as the hippocampus. The hippocampus is primarily our long-term memory storage area. Okay. Now, when a person, if the trauma is severe enough, there are mechanisms within these neural areas where I'm going to kind of put it in kind of human terms, where the amygdala and the hippocampus get together and say, let's not allow this person to have access to this traumatic experience. So there's a neural blockage to that memory. Okay. And then when the person becomes safe, that's when the amygdala and the hippocampus go, okay, we can unblock those memories. Okay, well, here you go. Um, this is something that I commonly worked with when I worked with people who went through especially severe acute trauma. For example, when I worked with sexual assault victims that were acutely traumatized. Okay. They tended to have very difficult times, not all, recalling that traumatic event. Okay. And what I used to do is I would always put on my calendar to make sure I contacted them frequently about 9 to 12 months after that traumatic event. Okay. Because usually what has happened after about 9 to 12 months is that person's social life has stabilized. They're getting back to work. They're doing okay. They have more distance between them and their offender, we hope. And so they start feeling safe. And it's usually around the 9 to 12 month where, I would call them and they'd say, I smell certain things and I have a panic attack. I've been waking up with nightmares. I've been having these weird flashbacks and all of those things. And that's where the brain says, okay, this person is in a safe place to have that memory. And that is what we have found with people who were chronically abused as children, is that they leave their home, they establish their adult life, and again, the brain sense that says it has sensed that they're no longer in that dangerous place to exist, kind of then can release these traumatic memories. Okay. Now, with that being said, so that's kind of the go around all this talk about repressed memories. I will say we do have to be careful with this because a good percentage of people who have recalled childhood abuse memories tend not to um, um, actually experience those events. They were seeded usually by a therapist or a friend that you must have been abused, and then they build those memories. And that's why if you have a friend or if you personally start to have these kind of events, go to someone who is specifically trained in trauma. Okay, just as a side note to that. So that's repressed memories. Okay, this one is one that always is a catch to a lot of students' eyes. This one is still a multi-million-dollar industry, and people still believe in it. I go to so many faculty trainings where the idea of learning styles comes up, and I have to roll my eyes as a psychologist. But very early on, we found through initial research, that when a teacher caters to a student's preferred learning style, that theoretically the student learn better. So when I'm talking learning styles, you learn auditorily by listening, uh, uh, kinesthetically by doing, um, um, visually by watching or reading, those different learning styles. And it suggested that if the teacher, if you learned in your best learning style, that you would learn better. Okay. However, research done over the last 15 years has infinitely denied that claim. We can't find any evidence that a person who learns in their learning style benefits from doing so. In fact, what we've actually learned is you really should learn in multiple learning styles, and you should really focus on the learning style that you least prefer. Because when we get to the memory section, we're going to talk about something called deep processing. And deep processing is where information really makes it so it sticks in long-term memory. And when you learn through a learning style that's harder for you to learn in, you tend to actually deep process more and you tend to shallowly process when you learn in your preferred learning style. So this is a myth. Unfortunately, I know a lot of people hold on to this and go, no, 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 I have to have things spoken to me, or I have to read it, I have to do it, and that's the only way I learn. Well, uh, science in science, as far as science is concerned, that's kind of a myth busted. Okay. Another one good as you start out your college semester is it's best to stick to your initial tuition on multiple choice questions. Again, initial research suggested that you should always go back and second kind of guess some of the questions. But we're actually finding that you're better off sticking to your first choice than when you go back. Okay, let me get through this. Okay. The last one is, and because this one is more of a popular cultural belief, is that people who have a psychological disorder are more prone to violence. So you'll notice whenever there's a mass shooting or a school shooting, we're always now all having the conversation about mental illness and access to mental health services, all of these kinds of things. If you work with if you know someone or if you work in inpatient settings, you'll notice that those patients tend to be more aggressive than the general population. And so there's this assumption that they, because of their mental illness, they tend to be more aggressive. Okay. But let's break some of these myths. Okay. First of all, you put anybody in captivity, it will increase their aggression. Whether you are the most healthiest person in the world, if we start to control every aspect of your day like you do in an inpatient setting, you will start to act aggressive. Okay. So it's a natural thing of the situation, not because of the person's mental illness. Okay. When we've investigated school shootings and mass shootings, we have found no evidence of mental illness as a causal reason. Now, there's mental health issues such as relationship issues, bullying, victimization, all of those kinds of things, but mental illness tends not to be a culprit in many of these cases. Okay. The other aspect is if you look at the etiology of a lot of the disorders individuals have, let's take depression. A person with severe depression does not have the motivation to plan violence. They don't have the mood or the desires there to make that happen. A person with anxiety is too anxious about their actions and the consequences that they're not prone to do that. If we look at a person with schizophrenia, the idea that a schizophrenic hears voices to harm others, that's actually a myth. A person with real schizophrenia actually hears voices of self-harm and self-deprecation. When is hearing voices of harming others, it's usually drug-induced by methamphetamine, cocaine, or some other hallucinogen. Okay, but it's not due to a disorder of that kind. And so the reason I bring this up at this point is that it is kind of when we look at these different situations, we need to stop distancing ourselves and trying to label someone who does a violent act as disordered or having a disorder because it makes us feel safe and comfortable. We really need to start looking at really what is producing that because we all have the propensity for violence. So, but we'll get into that when we get into the social psychology aspect of the class. All right. So those are just some examples of things that psychology initially promoted, but because of continued research, we have had to kind of step back and go, wait a minute, it's not what we originally found. And these are some of the examples of corrections that psychology has had to make through further research. Okay. And this is just an example. There's a lot of stuff that we need to change. But anyways, with that being said, all right. All right, gang, I am going to stop here